So I'm going to do some laser sculpting across the front part of this tooth here. Then we're going to take this tooth and try to mirror the adjacent tooth by removing some of the gum tissue in this area right here, sculpting with the laser. And in this particular tooth, the lateral incisor here is a little shorter at the gum line than the contralateral lateral incisor. So I'm going to raise the gum tissue a little bit on this side with the laser as well. So we're going to proceed with a little bit of sculpting here. Beautiful thing about the laser is it just basically simply removes the gum tissue by sculpting. And it cauterizes as it's going. Very simple procedure to do. And I'll get a different perspective of how things actually look. All the excess off of there. Thank you. It's a beautiful thing, these lasers, compared to the old days of using a scalpel to perform the same procedure. Now it's nice and clean. I'll do the cotton pellet again. Thank you.
A little bit more moisture.
This is one of the procedures that helps make the ultimate porcelain look so much nicer by making things symmetrical. And it helps to frame our porcelain with much more pleasant looking gum tissue as a frame. I'm going to just raise number 8 like 1/10 of a millimeter. And number 7, I'm going to get a little more aggressive with that and come up about another 1/2 millimeter. Very good. Now this tooth, number 7 here that I'm touching, is a much wider tooth than the tooth on their side because of the previous bonding. But now that we've got the gum tissues looking more symmetrical, when we prepare it and shape it for a new veneer, we're going to straighten all it out and make everything look nice and right width. I'm going to take a little bit more off this little outside part. So now we've ovalized the front 2 teeth, made the shape, and attempt to mirror each other. So we have that nice frame. And raise this lateral incisor I'm touching right now, we call tooth number 7, to attempt to match the height of tooth number 10. We've mirrored the tissue in between the teeth and surrounding the teeth and made things look a bit better, and now we're going to go ahead and shape our teeth and get ready for some porcelain veneers.
What do you think?
Honestly, my mind is blown. I can't quite move my mouth well enough to get the best look, but from what I can see, it's phenomenal. It's the word I have.